Hello, everyone. So glad that you are here. Welcome to the Future Inspired by You, a donor impact series brought to you by the Spectrum Health and HDV-CH Foundations. I'm Debbie Turner Bell, a member of the Helen DeVos Children's Hospital Foundation Board of Directors, and just so pleased to be here. I'm pleased to introduce the topic for this month. It is Brainstorming for the Future. This week, Spectrum Health opened the new Jack H. Miller Meg Center, the first of its kind in West Michigan, to offer complex brain mapping to improve outcomes for patients with epilepsy and brain tumors. The future of neuromedicine really is here. The innovation would not be possible without the generosity of our donors, and we want to give our heartfelt thanks to Jack Miller and family. To get us started, I'd like to introduce you to Dr. Hassan Morandi. He is the new president of HDV-CH, and we're just so thrilled to have him here. He came from the Peyton Manning Children's Hospital in Indianapolis, and he has dedicated his career to caring for children and has a passion for excellence and for innovation. And one last note, at the end of the program, our speakers will be available to answer questions. So be sure to take a note of your questions as we go through the presentations. Hold on to them, and the doctors will be so happy to answer them in just a little while. With that said, Dr. Morandi, take it away.
Thank you very much, Debbie. As Debbie mentioned, my name is Hassan Morandi, and I'm a general pediatrician by training. It is absolutely an honor for me to serve as the president of Helen DeVos Children's Hospital. December marks the fourth month now that I've been in this position, and I can tell you the past few months have been some of the most rewarding and precious in my both personal and professional career. Myself and my family are absolutely delighted to be here in Grand Rapids and be a part of this community, and professionally have an opportunity to join Spectrum Health, a very well-run, well-positioned healthcare system integrated, as well as having the opportunity to work in Helen DeVos Children's Hospital is just something that I'm truly proud of and very happy to be able to have this opportunity. With that being said, as I've started to learn more about the community, more about our referral sources and the staff that we have here, there has been a common theme that has come up that I have heard over and over again, that we are the best kept secret when it comes to pediatric care, not only here in the state of Michigan, but beyond. And that was surprising to me because we are truly a nationally ranked children's hospital. And I wanted to make sure that I did everything that I could in my power to make that no longer a secret, and for us to truly take our care and expand it as far as we can. So with that, I'd like to spend some time today introducing you or reintroducing you to our wonderful children's hospital. First slide, please. So I can't say enough about how amazing it is as you drive up a medical mile and to see this wonderful building and to think about that 25 years ago, this concept was just a gleam in the eye of some pediatricians and some members of the community. And to sit here in this building today, 25 years later, I can tell you the rapid growth and the what has been accomplished here in such a short period of time is not found anywhere else in the country. And that really goes to show the dedication that this community, the donors, the staff, and the organization has in improving children's healthcare, not only for the West Michigan community, but beyond. Next slide, please. What I'm very proud of letting everyone know, we are currently ranked in 8 different specialties among U.S. News and World Report's best children's hospitals. To tell you a little bit more about that, every year U.S. News and World Report has become the benchmark to rate children's hospitals, to be able to give the consumer, the parents, an understanding of who is providing the best quality care. There are 10 different categories that they look at quality outcomes and services provided. And we were very proud to be able to rank in 8 different specialties. Last year, 284 different children's hospitals applied to this ranking. And with what we were able to achieve, it places Helen DeVos Children's Hospital as tied for number 28 in the country. That is just absolutely amazing for for the young age of our children's hospital. Next slide, please. So to give you a quick summary of who we are definitely dedicated to improving the healthcare of children in the state of Michigan and beyond. Looking at both our inpatient and outpatient footprint, 234-bed freestanding children's hospital based here in Grand Rapids. We have a level 4 NICU, which is the highest level, taking care of the most complex patients, young as small as 23 weeks of age. We have a 108-bed neonatal intensive care unit, which is one of the largest ones in the nation. A level 1 pediatric trauma center, which is again the highest designation. A dedicated pediatric emergency room, which you hardly find in many places, except for well-established children's hospitals. Dedicated ICUs to pediatric cardiac care and pediatric neural care, as well as an EEG monitoring unit, which I will talk about a little bit more later. And obviously, outpatient, we have a significant footprint across many, many communities in the state of Michigan. Next slide, please. None of this is possible without our staff. We have over 350 pediatric subspecialists that currently work within Helen DeVos Children's Hospital. Next slide, please. Even with this past year in the midst of a global pandemic that none of us have ever seen the likes of, we were still continuing to grow. Last year, we added 22 new physicians and scientists to our medical staff, continuing to grow our footprint and our ability to take care of patients across the board. Next slide, please. At Helen DeVos Children's Hospital, we provide over 70 different specialties and programs. These are just a few of them that I have named here. Obviously, the ones that are highlighted are the ones I would like to talk about just a little bit. These are the ones we brought on just last year. The Adolescent and Young Adult Cancer Center, the Fertility Preservation, and Hepatology, taking care of pediatric liver disease, is something new for our program also. Next slide, please. When you look at the statewide presence, obviously the Helen DeVos Children's Hospital is the hub of all the activity, but we expand now to 58 different pediatric specialty clinics across the state and partner with 34 different healthcare facilities in Michigan. Now, I can sit here and talk to you for hours about the wonderful care that we provide here and the different specialties and the programs that we have. But today, I would like to concentrate on 3 of them that we will be highlighting over the 2021 as well as beyond. And those 3 will include cardiology and cardiovascular surgery, our oncology program, cancer, and our neurosciences. Next slide, please. Cardiology and cardiovascular surgery. We were ranked number 34 in the country. Next slide, please. Currently, we have 3 cardiovascular surgeons and 16 pediatric surgeons. Looking at our numbers, we will be performing our 2,000th surgery this year and over 1,500 cardiac catheterizations on pediatric patients. Next slide. Next slide, excuse me. We were awarded our certification in ECMO, which is heart-lung bypass. We received the gold level, which is the second highest, and we will be working for the platinum over the next 2 years. And our cardiovascular program received 3 out of 3 stars, only 1 of 11 programs in the United States to receive that high level. Again, highlighting the great work that they're performing. Next slide, please. Hematology and oncology, number 47 in the country. Next slide, please. This program has ranked for 9 straight years in U.S. News and World Report as part of the best children's hospitals. Again, our adolescent and youth cancer services are something that we have began this year. We're very proud of taking care of a lot of those patients that now are surviving and continuing to have a wonderful life as they go forward. Next slide, please. And last but not least, our neurosciences ranked number 42 in the country. And that's the one we will be spending some time on today to bring to you. Next slide, please. Our neurosciences program is truly setting a new standard in pediatric neuroscience care in the state of Michigan. Very, very proud of our epilepsy and brain tumor program. We're one of the first and only programs in the state of Michigan where we have a monitoring unit that's mobile. I also would like to talk about the Jack H. Miller Magnetoencephalography Center, or MEG, which Dr. Hernandez will talk about more. And with that, I'd like to turn the audience over to my colleague, Dr. Angel Hernandez, the Division Chief of Neurosciences here at Helen DeVos Children's Hospital. Thank you for your time.
Well, thank you, Dr. Morandi. It's great to be with all of you again to give you an update of pediatric neurosciences. As Dr. Morandi said, our epilepsy monitoring unit is the only one in the state of Michigan that has a completely wireless system where kids can actually roam around the hallways and play in the playrooms and be able to have shorter stays because we can get the information that we need with a shorter period of time. Thanks to Amy and Steve Van Andel Foundation, our EMU has expanded now to 8 beds from 6 beds, and that's because of the continued growth of our epilepsy program and becoming a leader within the state of Michigan in epilepsy treatment. The Children's Hospital is becoming the place where families and patients with epilepsy come to get answers and solutions to their conditions. We have a very close relationship with the adult neuroscience group, which helps us in transitioning many of these children into adulthood and continue their care throughout their lifespan. And we share a very common mission, which is to take care of all patients with epilepsy, not only in West Michigan, but also throughout the state of Michigan. And just to give you some idea of what we're talking about, is approximately 1 in 26 people in the United States currently live with active epilepsy. This affects about 3.4 millions of adults in the US and close to 500,000 children in the United States. And just to give you some more statistics, here in the state of Michigan, there are about 120,000 adult patients who live with active epilepsy. About 18,000 of those patients are children. And we take care here at Helen DeVos between 8 and 9,000 of those epilepsy patients throughout the state of Michigan. Unfortunately, about a third of patients that live with epilepsy have what we call uncontrolled seizures because none of their treatments are helping control their epilepsy. So Spectrum Health and Helen DeVos Children's Hospital for many years have been taking care of the most complex cases of epilepsy. In fact, the Children's Hospital has been ranked as one of the top children's hospitals in epilepsy care for several years now. Unfortunately, some of these patients that we care for right here in Grand Rapids had to leave the state in order to get a very specialized test called the magnetoencephalography, or MEG for short, as part of their evaluation of their very difficult to control epilepsy. And in some cases, patients that have very complex brain tumors had to leave the state to get this test done. So children and adult patients had to travel to Milwaukee or travel to Cleveland to get this test done, in many instances with a lot of hardship for many of these families and patients. But thanks to the wonderful gift from Jack Miller and his family, these patients and the families do not have to travel anymore. Last week, we partnered with our adult colleagues on the adult side for virtual ribbon cutting of the new Jack H. Miller Magnetoencephalography Center. And so I know how important for Jack Miller was when we first met. He expressed to me the importance that this MEG program would not be a one-man show, and I couldn't agree more with him when we talked about this. So I have surrounded myself with the very best in MEG, securing a very strong group of people with years of MEG experience. So as you see on the picture from left to right, Dr. Dave Burdett is one of the preeminent adult epilepsy specialist in the country, and he's right here in Grand Rapids, and he's had many years of MEG experience over time. Next to him is Dr. Evan Tank, another adult epilepsy specialist who came very well trained in epilepsy treatment and will also be partnering with us on MEG. Next, myself, who've had over 12 years of experience in MEG, and Dr. Hassan Morandi, who is an honorary magnetoencephalographer. And then lastly, Paul Ferrari, which is the brains of this program. Dr. Paul Ferrari is a PhD cognitive neuroscientist who will be helping us run the MEG program. Next slide, please. Just to give you an idea of how important this tool is in the treatment of patients with epilepsy, there are only 100 of these MEG programs around the world, only 50 in the United States, and this is the first one in West Michigan, and this is the only one at a children's hospital in the state of Michigan. MEG is more of a neurophysiological test, basically measures your magnetic fields in your brain that are generated by different brain cells. I always tell families that this is like looking at a needle in a haystack from a 40,000 foot view and finding that needle. So that we use this test to help us with localizing exactly where seizures are coming from. And the most important thing is this is a non-invasive test, which helps us localize where seizures are coming from and reduce the chances of morbidity on these patients. So prior to MEG, what we used to do is it will be more of an invasive type of procedure in order for us to localize where seizures are coming from. Next slide, please. So on this MEG, as I mentioned previously, is part of the pre-surgical workup of patients that have very difficult to control epilepsy and are failing anti-seizure medications, and also has been a very important tool in mapping different parts of the brain, especially for patients that have very complex brain tumors. Next slide. So in addition to having a lot of clinical utility, MEG is going to be an extremely important source of research into other neurological conditions. And we've already started partnering with Michigan State University and other researchers right here at Spectrum Health and the Children's Hospital, and have started working on different protocols on how to work on patients with strokes, how their brain recovers from stroke, and that's still an unknown to us, how the brain is able to do that. Also, we'll be starting protocols for patients with dementia, autism, movement disorders, and other neurological conditions. So I still think we are still learning a lot about the brain, and this machine will definitely help us in advancing that knowledge. Next slide, please. So I mentioned how important this is not only for West Michigan, but for the entire state of Michigan. We started to schedule patients last month, and we currently have our first patient next week on December 15th. We already have 31 patients already scheduled to come in for MEG in the coming months. Our expectation is that we will actually surpass our original numbers. We're thinking that we'll probably bring in at least 150 patients when we originally were considering bringing in about 100 patients. So we will definitely surpass the number of patients that we will be seeing this year. Next slide, please. So again, thank you very much, and I will welcome questions. Thank you.
Thank you so much, Dr. Hernandez and Dr. Morandi. So we would love to take questions. If you have some, please do put them in the chat. We do have a couple. Let's start, since Dr. Hernandez, you were the most recent one speaking, let's start with this question. Will the MEG be used for all patients with epilepsy and brain tumors?
So this test is reserved for patients that have very difficult to control epilepsy, and we are considering the possibility of a surgical intervention to treat their epilepsy.
All right, very good. Dr. Morandi, this question is for you. How many children are in the hospital now with COVID-19?
Obviously, COVID in pediatrics has been much less seen than in the adult population. As of this morning, we had 7 children within the Helen DeVos Children's Hospital who have tested positive with COVID.
And a follow-up to that, Dr. Morandi, have you seen in the children that have come into the hospital with COVID-19 that the virus affects them differently, or the course of the virus is different for them?
Well, definitely, we have seen some of the same symptoms that we have seen in the adult population, especially with the shortness of breath and some of those other challenges. But one thing that has been more commonly seen in children is what is called MIS-C, MIS-C, which is a inflammatory disease that affects multiple organs within a child's body. That is most commonly seen in pediatrics rather than adults, and we have treated multiple children with that here successfully.
All right, very good. Let's go back to you, Dr. Hernandez. How is the MEG different than MRI and the CT scanner?
Yeah, so the MRI and CT scanners are primarily what we call anatomical pictures. So we basically, it's just like taking a picture of you. I can see you very well from the outside, but I don't know how your body is functioning. So the MEG is actually showing us how your brain is functioning. And that's something that we cannot see on MRI or CAT scan.
That's incredible. Having gone to veterinary school, I don't know that I ever understood how the MRI or CT scan worked. So I'm doubly confused by Meg, but it's exciting that we have it. Dr. Brandy, how has your tenure? You've been here just a short period of time. How has it been so far? And tell us about your vision and plans for the next 5 years for the HDVCH.
Sure. Many people that have listened to me speak have heard me say I drive to work with a smile on my face and I leave with a smile on my face. And it truly has been a joy being part of this children's hospital, to work with the staff and be part of the Grand Rapids community. I think we have the ceiling is very, very high for Helen DeVos Children's Hospital. We are already nationally ranked, and we're going to continue to push to be even better known across the country, to continue to expand our services, our medical staff, and truly become a destination center where parents that are in need of care for their children look to us first to be able to provide the highest quality, safest care that they can receive. So we have a lot of plans for the next 5 years. That could take another show, but we are very excited where we are and what our future looks like.
Another question, and this is, I think, a great question as well. What made you want to come here?
Sure. When I looked at this opportunity, again, as I mentioned previously, the foundation that has been laid here in this hospital and in this community over the past 25 years to have us where we are today is just something that's not rivaled anywhere else in the country. And looking at the possibilities of what the future can be, this was something, it's one of those things that I just could not pass up. So I'm excited to be part of this, and I think we have so much more that we can do.
I'm glad that you did not pass it up. We're excited to have you. Dr. Hernandez, tell us a little bit more about the MEG. Can it be used for anything other than epilepsy and brain tumors?
So the quick answer is no. We don't have FDA approval for anything other than epilepsy and brain tumors currently, but one of the things that we're studying are different neurological conditions that we can predict when someone is going to have a neurological condition, maybe ahead of that condition happening, so we can start treatment earlier. Before I came to Helen DeVos, we started a project where we were looking at patients that were football players before their season, during the season, and after the season, to see if we can detect if there were already changes in the brain that would show us whether someone already had that or were sensitive to that chronic traumatic encephalopathy, which is the what has happened to many football players. So stay tuned. I don't have the answer yet, but we will definitely be looking into that as we continue to build the research part of the MEG program.
Let's talk a little bit more about that, as well as the as it relates to the capability of the MEG. Is it most useful in identifying the focus where the epilepsy originates when someone has a seizure, or can it be useful in determining perhaps something like triggers?
Yeah, so unfortunately not for triggers. Is very specific as to where the seizures may be coming from. It could go as deep into the brain as we can map. So it's a very good tool to locate where seizures are coming from, but not the specific triggers that some of the patients could have with epilepsy.
Here's another one. I don't understand this question, but I'm confident, Dr. Hernandez, you will. Could the MEG possibly treat someone who has seizures due to synapse and not epilepsy?
Um, so I'm guessing the question is regarding syncope.
Oh, perhaps. No wonder I
Yes.
didn't understand it.
Okay. So the answer probably is no. It's not a tool that we typically use for that type of condition.
I'd like to ask both of you to talk more about the importance of philanthropy in your efforts. Let's start with you, Dr. Hernandez, and then we'll circle back to you, Dr. Morandi.
Sure.
Well, the Jack Miller Magnetoencephalography Center is a perfect example of why we need philanthropy. And this tool is a tool that will benefit not only children, but also will benefit adult patients that have difficult to control epilepsy and brain tumors. Without philanthropy, we would not been able to have this piece of equipment here in West Michigan. And it's a very expensive piece of equipment. Is not every center, just from the numbers of MEGs that are across the country, that can afford to have this piece of equipment. But it brings up how serious we are about treating patients with epilepsy, and why we want to be able to bring patients here to be able to take care of them. We do need additional philanthropy to support other projects that we currently have within neurosciences, and so we would be more than happy to discuss those later for anyone that might be interested. But we would never been able to do this without philanthropy.
Of course. And Dr. Morandi, go ahead.
Sure. Philanthropy is such an important part of any children's hospital. And in my role, philanthropy is a 365-day-a-year job because I need that support from the community to be able to provide the best care that we do. Pediatric care is not cheap, and especially as we start to continue to grow our programs. Previously, you asked me, well, what are some of the things you're trying to do? Well, to grow our cardiovascular program to become a destination center and start to get into the possibility of doing heart transplants. That's going to take a lot of finances. If we're looking at our oncology program and push it to even further levels of the greatness that it has for the past 9 years, to become to the point where we're doing individualized treatment for a child, and not necessarily in West Michigan, where we can take the blood of a child that's sitting in Phoenix, Arizona, and have our team come up with a treatment that would help take care of that patient there in Phoenix rather than even here, to looking at our neurosciences and continue to grow our neurosurgery program, our neurosciences program with great tools like the MEG. All of that requires us to continue to look at our community for support and find those donors that truly believe and have been touched by some of the great care that has been provided by our physicians, and start to marry up the growth and evolution of the Children's Hospital with the opportunity to add philanthropy to it, to push forward, to become bigger and better than where we are, and to truly get to the point where we are standing in front of every parent and saying, we can treat your child to the best of our ability and what we have here because of the philanthropy that was given to us.
Yes, that's so wonderful indeed. Dr. Hernandez, a couple more questions for you. What type of research do you envision for the MEG, and when do you think you would be able to begin?
Yeah, so we have a list of potential research projects. So we will very likely start to collaborate with our stroke team here at Spectrum Health to start looking at how the brain regenerates after stroke and how we can better program their rehabilitation. So that's one thing that we're going to be starting soon, and I would say probably not until the spring that we will start doing additional research. Since we have a big backlog of patients, we definitely need to make sure that we take care of the patients first before we jump into the research part.
All right. Another question we've received for you, Dr. Hernandez, is how are alternative therapies such as ketogenic diet advancing?
Yeah, so we believe in the ketogenic diet as a potential treatment for some patients that have difficult to control epilepsy. We believe in that diet enough that we have a program that takes care of patients that need to be on the ketogenic diet with a full-time dietitian, in addition to a physician managing those patients and other support staff as well. Dietitians, unfortunately, is something that we need philanthropy for. We also have been able to receive enough money from philanthropy too to support families that don't have money to pay, for example, for scales. So scales are needed to be able to weigh the food that the patients need to get. And so thanks to the generous donation of many people, we've been using those dollars to buy equipment that the families cannot get reimbursed for by their insurance companies, because they still consider the ketogenic diet as a diet and not as a treatment for their condition. So we, again, very grateful for the foundation and all of the people that have donated to the ketogenic diet program, because many families leave this place with what they need in order to continue the diet at home.
Sure. Another one for you, Dr. Hernandez. And the question is, does the MEG provide better information than an EEG? And I'm going to add to that question, how is the information different?
Yes,
Dr. Hernandez?
a very good question. So EEG actually, yeah. So EEG primarily measures the electrical activity in the brain, and we're recording primarily from the scalp. So that electrical activity have to be amplified multiple times as it has to travel through different layers of the brain, plus the bone of your skull, plus the skin, plus the hair. And so it is not very accurate. It's helpful, but sometimes it's not as accurate as the MEG, where it actually is measuring that abnormal electrical impulse and using it in a way that we can measure the magnetic fields that are abnormal in the brain, being able to map more precisely where those seizures are coming from.
That makes perfect sense. Dr. Morandi, let me come back to you. Of course, top of mind for almost everybody these days is COVID-19. Right now, procedures are being planned and strategized for the administration of the vaccine. Tell me a little bit about how those plans are going there at the Children's Hospital. I know children will be higher on the list, or I think they will, than the average citizen like me. Can you talk a little bit more about that process?
Sure, absolutely. And you're absolutely right. We're in the midst of receiving our first doses of the vaccine here to be able to distribute it. And I want you to think about, as many of you have been on an airplane, and they always tell you during the safety procedures, if in the event of a landing and the oxygen drops, put the mask on yourself first before the child. And I think that's one of the things that we've had to learn through medicine. Many of our frontline workers, many of our physicians, staff members, nurses, they're the ones that are exposed to patient after patient after patient. And if they're not there to take care of the next patient and the next patient, then we failed. So the administration of the vaccine will begin with the very frontline physicians and staff members who are exposed to this on a daily basis, such as our emergency room physicians, our infectious disease doctors, our ICU attendings and nurses. They're the ones that will be receiving the vaccine first. I believe the CDC and the federal government has a very distinct guideline on who would receive those. We will be following that very, very closely, but it will begin with our frontline staff to be able to continue the great work that we do.
And Dr. Morandi, I don't mean to put you on the spot, and it's fine if you don't have this at your fingertips, but how much of the validation of the vaccine, the research of the vaccine was tested on children? And what do we really know about the vaccine and how it acts in children?
I'm probably not the best expert on that. From again, as a pediatrician, I've kept up with as much as I can. Most of the trials have been done on adults, and most of the children has been 12 and older.
Sure, and forgive me for putting you on the spot. It popped in my head, and I thought that might be the case. But let me ask you this: can you tell me how the staff there at the Children's Hospital is holding up during this pandemic?
I think if there's anything that I can tell you about the pride that there exists here is in the staff. They have been unbelievable in their response, in their selflessness and taking care of patients, of working extra shifts, doing additional duties in different areas, helping out our pediatric nurses working in the adult hospital to lend a hand to their colleagues on the nursing side, our physicians doing the same. The staff has just mobilized all across our health system, no matter what city or town or organization they've been in. And they have really done a magnificent job of helping us address this, as I mentioned, a pandemic that none of us had ever seen before. We feel very comfortable in how we have approached things and where we sit today with the support that we have.
All right, wonderful. Thanks for indulging me. Dr. Hernandez, a couple of questions for you, and I'm going to give you two because the first one I imagine is a short answer, and that is, can the MEG be used for infants? Also, someone has heard that there's a growing number of both adults and children with brain tumors. How will the MEG help with their treatment and potential outcomes?
Yeah, so the short answer about MEG in infants is yes, we actually can we can do MEGs on patients as young as newborns, all the way to adulthood. So we are able to do that procedure without any problems. Regarding the brain tumors, and we've had approximately 49 pediatric patients come in to the Children's Hospital with brain tumors in the past year, 2020. And that's an increase from last year as well. We don't exactly understand the reasons why there's been an increase of the number of brain tumors. We are definitely looking into specific areas where patients are coming in with brain tumors and seeing if there's any specific relationship to anything that may be happening in those areas. Now, the MEG is not a treatment tool for brain tumors. It helps the neurosurgeons locate where the important parts of your brain are located. Like, for example, the parts of your brain that make your hands move, the part of your brain that make you be able to speak, understand. And so those parts of the brain are extremely important as the surgeons are trying to remove a brain tumor on a patient. So that is where the MEG help us in minimizing the potential for those patients to be affected after a surgical procedure.
Couple of more questions for you, Dr. Hernandez. How long does it take to get results from a MEG scan?
So it usually takes about 7 days to get results. It takes us at least 7 to 8 hours to process all of that data. So it is almost a full day of evaluation of all the waveforms that we get from the MEG. So it's a very time-intensive test, and the busier we get, the longer the results may take. But we are aiming for less than a week, which is much better than national average. So we're committed to that moving forward.
All right. And one more question for you, Dr. Hernandez. Are you still recruiting additional physicians for the program? And can I throw in there with that, How much training does it take for a physician that's new to this technology?
Yeah, so this technology, so we currently are not recruiting new physicians. We are actually training new physicians. One of the advantages of Spectrum Health is that they have an epilepsy fellowship, and and providers that are or residents that are training in epilepsy will get exposure to the MEG, and so we are very proud of that. So in fact, not necessarily growing providers, but growing the expertise around West Michigan and the rest of the nation about MEG. It typically takes between 6 months to a year to learn how to do this procedure and do it correctly. So many people either finish their training and then have to go back and do a 6 months of additional training, or a full year of additional training.
Wow. Wow. That's quite a commitment. Dr. Morandi, one last fun question before we have to let you guys go. And that is, in the time that you've been here, what has pleasantly surprised you about whether it's the staff, the culture, the city of Grand Rapids? Tell us a little bit about how your transition has been.
Sure. As I mentioned, it has been absolutely a wonderful transition for myself and my family. I can tell you the welcoming nature of everybody that I've come across has been definitely palpable. It has been open arms, and no matter where we've been, within the hospital, within the community. We just recently, my wife and I recently bought a house. The neighbors, the first day, everybody coming together. It just really showed me how proud people are of Grand Rapids and this community, and just want everyone to be integrated into that. So we were excited for that. For me, be it at home or be it here at the hospital, we really feel at home already in a very, very short period of time. And I do want to put in a plug, though, the question they asked Angel about recruitment. As we continue to grow, as I mentioned, we had 22 new physicians last year. We're looking for many, many more physicians and many subspecialties, because we're going to continue to grow to bring the best care here to West Michigan. So if anybody is looking for opportunities, we have them here.
That's a very important plug to put in. Thank you so much. Well, thanks to you both, Dr. Angel Hernandez, and of course, Dr. Hassan Morandi. It's always a pleasure. We appreciate your time. I want to thank all of you for joining us today. Please do save the date for the next episode of The Future Inspired by You, which is January 14th. 2021, and it will be at noon. Be sure to make note of that time. This will be an interactive session titled Food as Medicine, and will be hosted by our lifestyle medical team. And it's an opportunity for our donors to learn from the experts about this personalized preventive approach to medicine and see the evidence behind lifestyle changes such as diet and nutrition to treat and prevent chronic diseases. That sounds fascinating, and I can't wait for it. I would like to say again another thank you to Jack Miller and his family for their very generous donation. Again, thank you both doctors, and thank you all for joining us. We'll see you on January 14th. Bye-bye.
Thank you.
Bye-bye.